mode.
Okay, good afternoon, everyone. We want to welcome you to the Food Systems Change Through Procurement Policy webinar, which is co-hosted by the Johns Hopkins Center for a Livable Future and the Chesapeake Foodshed Network. My name is Fitch, and I'm a program coordinator at the center. So before we begin, I want to cover a few housekeeping items. We have 5 presenters today who will each talk for about 10 minutes. And after all of the presentations, we'll open it up for questions. So you're welcome to write questions in the question bar on the right side at any time during the webinar. And after the webinar, we will send out materials that the speakers reference along with the presentation slides and a recording of the webinar. And if you're having any feedback noise, try turning down the volume. So I would like to first introduce our presenters and co-hosts and then talk about what we will cover today. So first off, Raychel Santo is a program coordinator for the CLS Food Communities and Public Health Program, where she works on a variety of research projects related to food policy councils, institutional procurement, the relationship between diet and climate change, and urban agriculture. She is also a Fulbright Scholar, pursuing a Master's of Science in Food, Space, and Society at Cardiff University in Wales. Colleen Synk is a graduate research assistant at CLF, where she focuses on farm institution procurement in the Chesapeake region and urban food foraging and production in Baltimore City. She's earned a Master's of Science in Public Health focused on health education and health communication, and a certificate in the food system, environment, and public health from the Johns Hopkins Bloomberg School of Public Health. Colleen McKinney is the associate director for the Center for Good Food Purchasing, where she focuses on the successful expansion and implementation of the Good Food Purchasing Program. She's contributed to the development and testing of the Good Food Purchasing Program in Los Angeles as a policy and program associate at the Los Angeles Food Policy Council. Jose Oliva is the co-director of the Food Chain Workers Alliance, which is a national coalition of food worker organizations that collectively represents over 300,000 workers. Jose has worked at the Midwest Latino Research and Policy Center at the University of Illinois and was later the executive director of Casa Guatemala, where he began to organize day laborers in Chicago's street corners. He founded the Chicago Interfaith Worker Center and then became the coordinator of Interfaith Worker Justice's National Workers Center Network. And finally, my name is Fitch, and I am a program coordinator for the CLF's Food System Policy Program. I work on food, agriculture, and nutrition policies at the federal, state, and local levels, with a particular focus on the public health and environmental impacts of industrial food animal production. I earned a Master's of Science in Public Health in the Human Nutrition Program from the Johns Hopkins Bloomberg School of Public Health in December of 2014. So, one of our co-hosts today, the Chesapeake Foodshed Network, is using some of the collective impact concepts to catalyze connections and collaborations amongst food system stakeholders in the Chesapeake region. And you'll hear a little bit more about the Chesapeake Foodshed Network later on. The CLF is an interdisciplinary center located at the Bloomberg School of Public Health, and our work focuses on the intersection of diet, the environment, food production, and public health. Our education program includes a food systems certificate, food systems coursework, curriculum development, and support of doctoral fellowships. And we conduct research, support other faculty members' research, and collaborate with other research institutions. We have 4 program areas at the center. The Food Policy Networks project is one of our projects, and the goal of the FPN project is to build capacity of food system stakeholders to reform local, state, regional, and tribal food systems through effective public policy. And we do that through training, sharing best practices, networking with other food policy groups and leaders, and developing and providing food policy resource materials. So now I will go ahead and turn it over to our first presenter, Raychel Santo, who will begin our presentation on institutional food procurement. Raychel?
Hi everyone, my name is Raychel, and I'll be providing a brief overview of the U.S. institutional food procurement sector and some of the potential benefits of reform. This information is based on the recent CLF report, Instituting Change, authored by Fitch and myself. Claire will be speaking after me about some of the specifics we found in our investigation into the food service rebate system. Next slide. But first, I'll cover some basics about the concentration and size of the U.S. food service industry, the purchasing power of institutions, trends in the farm-to-institution sector, and some brief highlights from our literature review of the potential benefits of institutions shifting to regionalized and sustainably produced food. Before continuing, I want to mention here that my use of the term regional in this presentation is inclusive of the term local, and the term sustainability encompasses all three of its pillars: social, environmental, and economic. Next slide. So similar to the trends in the food production, processing, and distribution sectors since the 1950s, the U.S. food service management market has become increasingly consolidated, as shown in this graphic. Here you can see the top three food service management companies: Compass Group, Aramark, and Sodexo, which comprise an estimated 45% of all North American institutional food service outlets. Given that 40% of operations are still self-operated, this means that 3/4 of the outsourced food service industry is operated by just 3 companies, which is quite significant given that the total North American food service industry is worth $72 billion per year. Next slide. So these 3 companies serve a variety of institutions, including colleges and universities, K-12 schools, healthcare and senior care facilities, prisons, cultural and sports centers, businesses and government buildings, and defense operations overseas. Compass Group owns a number of subsidiary companies, which makes it difficult for consumers to realize that it's all part of the same $13.6 billion company. For comparison, McDonald's makes $25 billion annually in global revenue. Next slide. Consolidation in other parts of the food system, notably the seed, manufacturing, and food retail industries, has also threatened the continued existence of many mid-sized, regionally located producers. These are often referred to as agriculture of the middle, and they lose their autonomy over farm management decisions and in contractual agreements with this consolidation. However, with the steady and significant demand of institutions, they're very well positioned to support and expand the essential markets of mid-sized producers. Institutional policies can not only directly affect the economic and physical infrastructure of the current food system, but if accurately and widely marketed, these efforts may also generate broader awareness and discussion of its impacts amongst students, workers, and other people that are just eating the food in institutions. Next slide. Just the public, in the interest as well, in the structure and effects of the U.S. food system, people may be unable to engage in ethical eating practices because of structural factors, such as which foods are available at their schools, hospitals, and work sites. Hence, many have begun organizing efforts to reform institutional food procurement practices, which has translated into a growing farm-to-institution sector. Right now, 6% of hospitals, 42% of public schools have established local food procurement programs, while students at over 200 colleges in the Real Food Challenge National Network have been auditing and reforming their dining procurement practices. 40 of those universities have now signed pledges committing over $60 million per year to purchasing more local, fair, sustainable, and humanely raised food. Next slide. While the Real Food Challenge criteria encourages student auditors to take a broader look at the food system, most farm-to-institution procurement across the country have concentrated on purchasing local food and do not necessarily take into account the structure and size, treatment of workers, health and environmental impacts, or the animal welfare standards of different producers. This is important because local or regional food systems are not inherently more ecologically sustainable or socially just than systems at other scales. An institution may be located near a factory farm, for instance, or a small-scale farm may still provide poor working conditions for farm workers. Hence the role of third-party certifications to ensure that all of the benefits that institutional procurement policies nominally support are actually pursued. And it is worth noting that some initiatives do incorporate broader procurement criteria have been underway in Europe, Brazil, Japan, and Canada, in some places for over a decade. Next slide, please. So how do we account for all these other factors then, besides just the distance to the farm? Well, it's important to recognize that understanding the impacts of the current food system is absolutely essential in order to accurately portray the reasons and thereby gain support for regional and sustainable food procurement policies, and to design effective policies to address these issues. The literature review in our Instituting Change report was intended to compile key studies and information so that those promoting procurement can create more comprehensive and evidence-based practices. I'm going to provide a very brief overview of our literature review, but we encourage you to check it out for a more comprehensive look and full sources for each of these considerations. I also want to emphasize before continuing that there's no binary distinction between small-scale and large-scale producers. between family farms and corporate ones, between agroecological production systems and industrial ones, or between actors in an alternative local food system and those in the conventional global one. Many producers fall somewhere in the middle of these spectrums, a position that provides them more flexibility than industrial producers to transition to more socially, economically, and environmentally sustainable systems, while also meeting a significant portion of regional food demand. So firstly, we'll go to the socioeconomic considerations. Supporting local farmers and aiding the local economy are some of the top reasons that promoters cite for engaging in farm-to-institution programs. How does the literature align with these values? Well, studies have shown that industrial farms lead to poorer socioeconomic outcomes for the rural communities in which they're embedded. Shifting institutional procurement away from industrial farms, and especially towards mid-sized regional farms, which have the capacity to meet institutional demand and to transition to more sustainable practices, is one way that may counter these trends and strengthen community well-being. Next slide, please. The economic impact of procuring food from more regionalized sustainable farms is less clear. Thus far, institutional procurement has had a negligible impact on participating farmers' incomes, as most food service orders comprise only a small percentage of farmers' total sales, while also requiring extra time and commitment from farmers compared to conventional markets. Despite the lack of direct economic benefits, however, institutional food procurement helps participating farmers diversify their markets, increase off-season sales, and gain an outlet for surplus and/or less desirable foods. Assessing the impact of institutional food procurement on the larger regional economy is not a simple task, and there are many debates among experts about whether one can actually use economic multiplier calculations, which try to calculate how much money stays in a regional economy for alternative food networks. Ultimately, while slightly more jobs in the regional economy have been associated with regional food procurement, it may be more important to promote the more proven socioeconomic benefits coming from regionalized food economies, such as the formation of relationships that strengthen social capital and networks in the areas of impact. Next slide, please. So on to the environmental sustainability considerations. A growing body of evidence shows that, particularly in industrial countries like the US, dietary shifts towards reduced animal product consumption and the consumption of animal products lower on the food chain have a greater potential for reducing our dietary ecological footprints than supply-side production improvements or reducing food miles. Many institutions are thus exploring many changes to encourage the consumption of more plant-based proteins and fewer animal products, such as meatless Mondays. Given that 31 to 40% of food in the US is wasted each year, and that discarding food is akin to discarding all the negative social and environmental impacts involved in its production, institutional policies can also work to reduce food waste in the first place, donate edible uneaten food, and compost the remaining scraps. Next slide, please. Taking a health perspective, institutions can help promote healthier food consumption by making meals comprised of high-quality produce, whole grains, legumes, and moderate amounts of animal products, accessible, tasty, and affordable. Studies have shown that reforming the food environments around us, such as our cafeterias, may actually be more effective in promoting healthier diets than interventions targeting individuals. And looking at the broader community health impacts of our food system, many of the harms fall disproportionately on food system workers and their families, communities of color, and lower income communities. Residents living in agricultural communities also face a number of physical, mental, and social health risks associated with their proximity to industrial crop and/or farm animal operations. As shown in the map on the right, many of these farms and their associated threats to health and well-being are concentrated primarily in communities of color and lower income communities that lack the socioeconomic and political power to prevent, mitigate, or adapt to these environmental inequities. Next slide, please. Food chain workers in the US and abroad also face poor working conditions, low wages, substandard housing, and inadequate labor rights. Therefore, institutional commitments to avoid purchasing from farms with these poor working standards for farm workers or with harmful impacts on local communities may begin to shift industry norms towards more socially just practices. As a positive example of this, the Coalition of Immokalee Workers' Fair Food Program, which has been named by some as the best workplace monitoring program in the US, owes much of its success to the commitments that food service companies, pressured by consumers, have made. Next slide, please. And finally, the vast majority of animals in the US are produced in intensive operations where they experience physical and psychological harms. Given that there's limited federal government regulation regarding farm animal treatment, a number of third-party certifications have risen to meet the demand for humanely raised animal products. Over the past decade, food service companies such as Bon Appetit have been adopting animal welfare standards in support of these third-party certifications, which have begun to change industry practices. Next slide, please. So now I'll pass it off to Claire to talk more specifically about some of the findings of our report on one of the major barriers to institutional food procurement. If you have any questions, please ask during the Q&A session. Thanks.
Thanks, Rachel. Okay, so now I will speak about the second part of the Institute in Change report, which focused on the barriers to changing institutional food procurement and also offered some recommendations for different audiences and tools and resources that people might find useful. So institutions face several barriers in increasing their purchases of regionally and sustainably produced food, and small and mid-sized producers also face several barriers in supplying institutions with their products. So for example, there's often a lack of distributors and processing facilities for independent producers, and there can be a lack of year-round availability of certain high-demand foods or a lack of vendors selling regionally produced food. For example, an independent lettuce producer may not have facilities to wash and package their lettuce locally, or they may not have a local distributor who works with nearby institutions in order to transport their product. So there are many infrastructure challenges that exist for institutions and for small and mid-sized producers. But what we cover in the report and in this webinar is really not intended to be an exhaustive review of all of these barriers. We found that there seemed to be a gap in the literature on farm-to-institution purchasing and a potentially major barrier that was unexplored by many other organizations, and that barrier is tied to food service management contracts and the rebate pricing system. So what we found is that institutions that contract with food service management companies or that belong to a group purchasing organization may face unique barriers to regional food procurement because of the business model of these food service companies and organizations and the rebate pricing system. So to give you an overview of the rebate pricing system, food service management companies usually charge relatively low management fees in order to secure contracts with institutions. When an institution signs a contract with a food service management company or joins a GPO, the management company or GPO may then work with a list of vendors that will provide volume discount allowances or rebates back to the management company when their contracted institution purchases from those vendors. And in this case, an institution is given a list of preferred vendors and instructed to buy a high percentage of all of their purchases from that list. And if they stick to the preferred vendor list, they may even receive bonuses or financial incentives. Food service management companies do not generate all their revenue from these management fees or from the management fees that they initially charge an institution. They also make a lot of profit from these rebates. So it's not unrealistic to think that the preferred vendor, whether it's a producer, a manufacturer, or a distributor, will just mark up the price of their product and pass that along to the institution. So that at the end of the day, the food service management company is getting a rebate of an undisclosed amount while the institution may be paying a marked up price for a product. And we've heard from food service professionals that their requirements for buying on contract or from that list of preferred vendors can be up to 80 or even 100%. So this obviously would limit the institution's ability to buy from a different, perhaps smaller, regionally located producer, as those producers may not be able to offer volume discounts or rebates and thus compete with other large-scale producers. So when institutions investigate whether they can purchase a higher percentage of their food from regionally located producers or producers with better practices, they may be constricted by their agreement with their food service management company or GPO to buy a high percentage of their food from preferred vendors. So how pervasive is this problem? This profit model is actually relatively new. John F. Carroll, who was the former Assistant Attorney General for New York State, he estimates that it's only been since the late 1990s and early 2000s that the profit model has been skewed this way. USDA realized that there was a problem, and in 2007, they promulgated a rule that made it illegal for federal funds that are designated for the special milk program, school lunches, etc., to be used on rebates, so that all rebates received by food service management companies working with schools had to be returned to the school. In 2010, Sodexo settled with New York State for about $20 million for withholding rebates and discounts that were supposed to have been returned to school districts. In 2015, Chartwell's paid a $19.4 million settlement to Washington, D.C. public schools for the same issue. So it's important to recognize that management companies withholding rebates is only illegal if there are federal funds involved. Otherwise, institutions have no idea how much money their management company is making off of rebates, or how much a vendor may be marking up the product that the institution is buying. So this is a very recent issue, and it's one that needs to be examined in every food service contract. We have a number of recommendations for different audiences in our report, but I'll just briefly summarize them here. So consumers, which could be students, parents, patients, government employees, etc., they can raise concern with their institution or join or organize a campaign with specific requests to improve their institution's procurement policies. Employees of food service companies and institutions can request and examine their purchasing information and their food service contracts, and they can request that certain commitments be made by their institution to purchase a certain percentage of their food from producers that are either regionally located or exhibiting more sustainable, humane, and fair practices. Policymakers can investigate their affiliated institutions' policies and consider legislative efforts around procurement that have succeeded in other states or cities. So for example, Massachusetts passed a law that mandates a preference for food products grown or produced within Massachusetts. And a variety of cities and counties, including San Francisco, Albany County, Cleveland, and Woodbury and Lynn counties in Iowa, they've also passed resolutions supporting regional and/or sustainable food procurement. Other concerned citizens can join a food policy council, write your representative, or collaborate with an organization that's already working on procurement in your area. And food policy councils might also consider supporting the Center for Good Food Purchasing's standards in their cities or communities. So here's a number of tools and resources for later, and you're about to hear a lot more about the Center for Good Food Purchasing's standards. So with that, I will turn it over to Colleen McKinney, who's the Associate Director for the Center for Good Food Purchasing. Oh, sorry. Colleen Synk. We're going to come back to Colleen McKinney in just a minute. Right now we have Colleen from the Chesapeake Foodshed Network and CLF.
Hi, so I'm going to talk a little bit about the Chesapeake Foodshed Network just to give a little grounding for the work I did. So as mentioned before, they're trying to bring different stakeholders together to focus on fostering a more sustainable, just, and resilient food system in the Chesapeake watershed. So basically the areas in the region, though, that we're focusing on are all the states that are connected to the watershed, with the exclusion of New York, because they're generally considered to keep their food within state or move their food northern. So I did an analysis about farm to institutional procurement using data about DC, Delaware, Maryland, Pennsylvania, Virginia, and West Virginia. And so basically the Chesapeake Foodshed Network has a infrastructure in which there's multiple different work groups, and I became invested in this project through the data work group. They took on several different students to help build capacity. The network is actually in its first major year, and having data was a main focus to help inform their different strategies and policies as they're moving forward. So as a student who had a lot of time in comparison to the other students they took on, Farm to Institution was given to me because they thought it was one in which there's a lot of political will, and one that would really help create and foster a regional identity for the Chesapeake. So basically the aims of my research was just to find any existing data for the region on these different institutional sectors. We looked more broader, but found that there actually wasn't a lot of data on the other sectors, so we focused just on these three. Also, I looked on trying to identify trends, within the region and the subsectors, as well as gaps and then best practices that were being used across the region. So how I went about this was just doing an initial scan using a broad array of terms for different sectors and different regions. And then I databased different stakeholders for one to help engage them in the region, and then also data these stakeholders and agencies might have particularly pertaining to food budgets, pledges and commitments to procuring, as well as secondary farm to institutional activities. So some of the main sources that I found for the different sectors was, of course, the farm to school census for K through 12 schools, which had a very good depth and expansive amount of research being done already. And then for universities, it was great that we were able to get Eat in Park, to offer some of their data as a food service provider, as well as some older data from the Sustainable Endowment Institute, and then also data on report cards of colleges, different sustainable measures from ASHE. For hospitals, we had very similar, the Eat in Park, as well as MDH2E, and then Healthcare Without Harm. So through all these different mergings of different data sources, I was able to identify 248 different institutions to examine their food budgets. Of course, when you're looking at this, there's a lot of gaps that existed in the region where we didn't have information. And of course, these gaps help identify what kind of work we might need to emphasize later in the future. Also, when you look at this, though, there's has to be acknowledged that while 248 is quite a decent number, it's actually still relatively low, and that's mainly because of the inclusion criteria that we had, which had to do with having total budget information available from all institutions. And then we had an extra layer of criteria for K through 12 schools because of the depth of and fine-tuned details in the research we had from the farm to school census. So taking the information on total budget data, we then estimate what's happening regionally with total food budgets of these 248 institutions, what was being spent locally, and found that nearly 12% was being spent locally, which I think is a great accomplishment for the Chesapeake food region as just one benchmark and baseline. But then we also took these total annual food budget data and projected what it would mean if all of the institutions shifted just 3%. So the institutions that had no local food spending shifted 3% of their spending to local, or those that had 20 shifted 3, so that 23% of their spending was local. And so just looking at the 3%, I'm going to give some context to what these numbers means. So looking back at the numbers before, it would mean that nearly $66 million would be spent on local. So that kind of increase would actually mean that it would be a 25% increase from what was already being spent local. So these small shifts can have a really large impact for regional farmers. Some other information that I examined were numbers of methods that different institutions were using and what kind of methods. And we saw that there was this kind of sweet spot that was occurring for institutions using 2 to 3 methods of procurement, most heavily distributors and then direct with producers or direct with processors were mentioned. Also, we examined different barriers that were identified, and I think the top 2, year-round availability as well as higher prices, really give a rationale for this regional focus that the Chesapeake Foodshed Network is able to offer. So with larger hardiness zones, while it won't necessarily cover the whole entire year, there'll be a greater connectedness of availability of products. Further, with greater scaling, higher efficiencies might be able to be earned to help lower the prices and make these products more available to institutions. And finally, we also looked at some pledges. So trying to identify institutions who might not necessarily have total budget data available or are procuring local, at least now, but how they might have other sustainability pledges that might be indicative of their interest in actually procuring local, and how we can try and contact and connect with these institutions to push the farm to institutional agenda for the Chesapeake region. So a lot of limitations do exist, particularly as noted on the slide of who was included. There's it's really not a whole landscape, it's just one little pinpoint of time, and there's not that many institutions in the whole grand scheme across the region. Further, to get even the 248 institutions that I examined, I had to merge a lot of different data from different years. And so with different trends in food procurement that might be happening, it's not necessarily the most accurate view. And finally, all of the numbers that were used to create this analysis were all self-reported. So there might be some recall bias amongst the institutions as they're reporting out their numbers. So moving forward, the Chesapeake Foodshed Network has really started to identify farm to institution as a new and more important sector of their work. And so this illustration is now their new visualization of what we're doing. And so originally there wasn't a farm to institutional work group, but we're now trying to move that way. And so we've already started trying to identify what kind of data our stakeholders as part of the as part of the Chesapeake Foodshed Network, what their needs are and how we can take those needs and help them collect data as well as just gain a better picture of what's already occurring. And then we're also trying to focus on already existing points of aggregation. As I mentioned before, ASHI was one point of data collection for us, and they're already aggregating information on universities. So how can we reduce the burden on institutions when they're reporting out this information, but so we can still get really fine data from them? And then with the pledges, how can we target institutions in different ways and help advocate for them to move towards using farm to institutional procurement across the region? I'd just like to acknowledge multiple different people that I worked with on this project, and then here are some of the references and data that I used. And if you could please leave your questions to the end. Thank you. And now Colleen will begin and talk about the Good Food Purchasing, the Center for Good Food Purchasing.
Thank you. Hi, I'm Colleen McKinney. I'm the Associate Director of the Center for Good Food Purchasing. I am excited to spend my time on this call today introducing you to the center and giving you a little bit of background on our approach to making change in institutional supply chains through our National Good Food Purchasing Program. Our approach is a national-local linked strategy that recognizes the value of a cohesive set of definitions for good food that link location-based work together across the country for the type of scale and impact that can influence major sectors and companies within the food industry, but also taps into place-based procurement solutions for building strong regional supply chains that are responsive to local needs and circumstances. Once I go through a brief overview of the center and the Good Food Purchasing Program, which I'm going to refer to as GFPP throughout, I'll turn it over to one of our key partners, Jose Oliva from the Food Chain Workers Alliance, to talk a little bit more about the local place-based side of the work and provide a couple of examples of how the Good Food Purchasing Program has been implemented and looks in practice. Next slide. The field of food procurement is active and growing, with institutions of all sizes and types adopting local sustainable preferences or focusing on healthier food procurement. And it's also an area that's being worked on more and more by food policy councils and other place-based food coalitions. The Good Food Purchasing Program focuses specifically on getting good food purchasing policy adopted and implemented in public institutions for a few reasons. Their leadership potential to inspire other institutions and act as anchor institutions, their responsibility to spend taxpayer dollars in a way that aligns with constituents' values, and the fact that they often serve communities that are more commonly those with high rates of hunger and lack of access to good food. The Good Food Purchasing Program has helped to define good food values with measurable, flexible criteria and increase public participation in the procurement process. Next slide. This slide just gives a quick summary of the mission of the Center for Good Food Purchasing. Our goal is to create a food system that prioritizes the health and well-being of people, animals, and the environment. And we do this through the nationally networked adoption and implementation of GFPP. The Center for Good Food Purchasing was created to guide the national expansion of GFPP in 2015. And we work with major institutions to monitor their compliance with GFPP, measure progress, and celebrate improvement over time. Next slide. I think it's helpful to know a bit about a bit of context about how GFPP was developed to give a little bit of background as to how the center got to the point where we were created in 2015. So GFPP was developed by a multi-sector working group of the Los Angeles Food Policy Council, and adopted by the City of Los Angeles and Los Angeles Unified School District in 2012. Soon after, we created the Good Food Purchasing Program to assist institutions with implementation, measuring progress, and providing recognition. This process in Los Angeles really served as a test case for creating and developing scalable, replicable infrastructure that is broadly applicable even outside of Los Angeles. So when food policy councils, local coalitions, and public officials in other cities started approaching us about applying the GFPP framework in their locations, we realized there was a really great opportunity to make GFPP a national program and expand the impact that we were seeing in LA. So we spun off from the LA Food Policy Council in 2015 into the Center for Good Food Purchasing, and we're now working in about 10 other cities across the country. Next slide. The breakthrough of the Good Food Purchasing policy is that an institution commits to meeting a baseline in each of these 5 equally weighted value categories, and no issue is left behind. So another piece is that the policy explicitly incorporates a baseline for valued workforce and animal welfare, which are less commonly included in good food procurement policies. We think about it like LEED certification, but for food. So what that means is that we have developed a tiered points-based scoring system in the Good Food Purchasing Standards that's based on broadly relevant third-party certifications and product claims within which an institution can create a really specific and tailored action plan for its particular food procurement needs. So institutions are rewarded in the program for higher levels of achievement, which is reflected in the overall score and star rating from 1 to 5 stars. The key to making GFPP work is traceability, which is what allows the center to provide verification to the institutions that participate. But really our larger goal is to improve institutions' knowledge of their supply chains so that they can support suppliers and producers in their region that are responsible and potentially the traditionally disadvantaged suppliers in the broader food chain landscape to the best of their ability. Next slide. So we've seen this model really actually have some results in our first test case, our first major test case, which is the Los Angeles Unified School District. LAUSD is the 2nd largest buyer of food in the state of California with an annual food budget nearing $150 million. LAUSD's commitment to GFPP has demonstrated substantial ripple effects along the supply chain. And in early implementation, we saw that LAUSD redirected about $12 million in produce purchases toward local growers, helped create 150 new quality jobs in Los Angeles County, and contributed to higher wages and improved working conditions for 160 truck drivers in their supply chain, adopted meatless Mondays and decreased their meat purchases by over 15%. And then most recently, they approved a contract for $20 million of chicken produced without the use of subtherapeutic antibiotics, which accounts for about 1/3 of all of the chicken that they'll purchase over the next 5 years. And finally, they catalyzed the reformulation of products to create healthier meals for students. And you know, we've seen this really impact their attitude toward their food purchasing, where their messaging has talked about how good food is a right for students, not a privilege. So it's really something that they're internalizing in their work at the district. Next slide. So school districts in particular are a huge opportunity because they spend billions of dollars on food a year, about $15 billion through the National School Lunch Program, and serve meals to children often with least access to good food. So if you look at the school districts and just some of the locations that we're working, it accounts for at least 1.5 million meals per day. So if you translate this into dollars, it's astonishing to think about the huge impact that can be had through this model on a daily basis. Next slide. We're working with a broad range of national and local partners, such as PolicyLink, Food Chain Workers Alliance, School Food Focus, Heal Food Alliance, Teamsters, UFCW, and local food policy councils in a number of cities to transfer, scale, and network the GFPP model. So right now there's active GFPP work occurring in California cities such as Oakland, San Francisco, Long Beach, and Los Angeles, and across the country in places like Austin, Chicago, Minneapolis, Cincinnati, and more. Next slide. So in closing, I just want to summarize our approach to making positive change in the food supply chain. Overall, we view GFPP as a tool and a framework available to our local partners to complement and strengthen existing procurement efforts. Through this model, we focus on increasing cross-sector alignment through our standards, monitoring compliance and measuring impact, using the policy process to create transparency in the supply chain, and using that to increase knowledge to drive changes in food procurement decisions, and aggregating the buying power of the largest institutions in cities around the GFPP framework, and then linking these efforts nationally. Next slide. In working with organizations like food policy councils, we hope the GFPP framework inspires local coalitions to feel like they have a tool and a support system in the center that handles details like verification, so that they can really be focused on setting a bold vision for local food procurement and guiding local institutions toward a regional food system that meets the vision of an inclusive and equitable system for all. So on that note, I want to turn it over to Jose Oliva to talk about how we're taking this collaborative multi-sector model and applying it to building strong coalitions in support of GFPP work in places such as Chicago and the Twin Cities.
Thank you so much, Colleen. And thank you to both Colleens, I guess, to Claire and to Rachel. I just want to say before I jump into this that the report is fantastic, and it really sort of reiterates a lot of the work that is happening around the country, and sort of the notion that I'm going to emphasize and while I present. But I want to start with just a quick story. We got started in 2008. I was at ROC at the time, the Restaurant Opportunity Center, and I kept running into folks from the Coalition of Immokalee Workers and Brand Workers and GATA and a few other food worker organizations and a variety of different spaces emphasizing food. And we started to realize that, you know, there wasn't really a whole lot of focus on food workers in these spaces. And, you know, the motto of nothing about us without us is for us was something that was ringing true in those spaces for us at the time. And so we decided, those 5 organizations that I mentioned and a few others, to sort of come together and to create a coalition of food worker organizations, which is what is now known as the Food Chain Workers Alliance. Next slide. And so in these spaces, what we were noticing was that there were sectors in the food movement, right? There were folks who were concerned about human health, the impact of food on our bodies, folks who were concerned about the ecological impact of food, both on the production and on the food waste end. There were folks who were, you know, fairly concerned with both access to good food and also growing food, growing your own food, so sort of food sovereignty. And then there were us, right? There were the workers in the food system. And so from the get-go, we had a mandate that we could not, by ourselves, any of these sectors, actually address any of the problems that the sector itself set out to address without the other sectors, because we are interconnected and because the reality of the food system is that it is a system and it's not possible to squeeze one end of the balloon without making the other end blow up. Next slide. So before I go into how we landed on GFPP and working closely with the Center for Good Food Purchasing, I just want to go over some of the numbers really quickly, just so that we have a sense of who the workers are. So there's 5 sectors in the food system in terms of labor, right? There's the food production end, those are farm workers; food processing, that's meat, poultry, and food processing. There's distribution, that's both warehousing and some light manufacturing. And then there's retail and service, sort of at the consumer end of that tree. And the folks that work in this food system account for over $1.8 trillion worth of annual sales. That's 13% of the GDP of the United States. Over 20 million workers in this sector, so it's a huge sector, and it's next slide, please. And it's one of the worst sectors to work in. So ironically, food workers are the most food insecure group in the United States. 25% of food workers roughly are immigrants, and so that accounts for some of it, right? Especially if you're undocumented, you don't have access to the safety net of WIC or some of the other food programs. But it's also just the extremely low wages, right, and sort of the squeeze on both ends. So I don't have to read this to you. I'm not going to do PowerPoint karaoke, but you can see by just looking at these charts that there's a real a potential real collapse of our economy. If you think of the largest sector of the economy being food workers, being the lowest paid and some of the worst conditions, that's literally setting the trend and setting the standards for the whole rest of our economy. And so for us, it's both a matter of real survival of our species, not to sound drastic, right, but the fact that food waste, for instance, accounts for roughly 1/3 of all greenhouse gases, combined with the fact that this is creating an economic disaster. I think it's safe to say that this is a fairly urgent matter for us. So next slide. So one of the things that we can see pretty obviously when we look at the food system is, there are health effects, right? Obesity and diabetes. There's inadequate access to real food. There's some of that is because folks can't afford that food. And that is, in fact, caused by low wages in many cases and unemployment. And that is, in fact, because there's a concentration of wealth and resources, and there's a systemic prioritization of profit over people and the planet. And so, next slide. So, because we had this mandate from the get-go, as we created the Food Chain Workers Alliance of creating multi-sectoral coalitions, we started to develop a coalition of coalitions that we're calling the HEAL Food Alliance. And HEAL stands for Health, Environment, Agriculture, and Labor. And its intention is to bring all of these sectors that are working around food issues together into one broad coalition, so that we're focused on transformational change of the food system. Next slide. And of course, one of the perfect examples of how we can do this is through what Colleen just explained to y'all, right? The Good Food Purchasing Policy, which I think is the most, or one of the most comprehensive food procurement policies in the country. It is for sure the only one that includes labor comprehensively in public institutions. I know the Real Food Challenge includes labor in university settings, but in public institutions, the GFPP is the only one that includes workers in it. And for us, the core of the leadership of that process has to be workers in order for it to be genuinely led by the people who are most directly affected, right, the frontline communities. Next slide. So we're currently leading campaigns in the cities that are listed here. I want to talk to you really briefly about the experience here in Chicago, where I am based, just to give you a sample of the work that we're doing. We started about a year ago at our annual Chicago Food Policy Council's Food Policy Summit. And at that summit, we presented GFPP as a policy that the Food Policy Council might want to consider. We presented it, folks thought it was a perfect fit, a match really for all of the work that the Food Policy Council had been doing up until that point, and they decided to run with it. And what we did next is we took advantage of a runoff election between the mayor, Rahm Emanuel, and a candidate, Jesus Garcia, and got both of them to put out statements saying that they would support GFPP if they were the mayor. And so then Rahm Emanuel won, so he then assigned a group of folks to work with us to explore how GFPP would work in the city of Chicago. We were lucky enough to have a Chicago Park District Commissioner as head of the Chicago Food Policy Action Council, Erica Allen. And so she was able to make the Park District sort of pilot GFPP. And so we're right at the very verge of actually launching the pilot program in the Park District here in Chicago, with a dual purpose of demonstrating feasibility and scalability, but also with the obvious purpose of ensuring that we have proof to community members, to folks in the frontline communities, that this is something that actually will impact their lives, that it would have a positive impact on their lives. Our hope is that once we have this pilot running for a few months, that we'll be able to go back to the city council with some data, introduce an ordinance, and do a similar process that happened in LA, where we would pass an ordinance and then work with the public school system and with several other public agencies to make sure that GFPP is implemented in those agencies. That's where we're at right now in Chicago. We are working, we're sort of at the beginning stages in both Cincinnati and Twin Cities. Our first step, or the first step that we suggest to people, is to build a multi-sectoral coalition, right? A coalition that really represents all 5 of the value categories of GFPP, in order to both be rooted in community, rooted in a real sense of what the frontline communities need, but also to have power, right? To be able to move this legislatively in the city council or in county or whatever level of government you're moving it in. Yeah, next slide. So with that, I just want to say that it is an absolute pleasure to be working with the Center for Good Food Purchasing. I know that instituting change, the report, is going to be a very useful tool for us to move the policy forward. And in the context of ensuring that workers in the food system, especially the lowest paid workers, are made whole, I think GFPP takes huge strides in that direction. So yeah, thank you very much.
Great, thank you so much, Jose and Colleen. I just want to open it up for questions now. It looks like we have one. So we'll go ahead and start with that. And if any of you have additional questions, just go ahead and type them in the box. So let's see, were the statistics around 6% of hospitals sourcing local foods, national or regional statistics? And does that include sustainability? So organic, fair trade, Food Alliance certified, those types of certifications. Rachel, do you want to begin with answering that, or?
Sure, I can answer. Yeah, that's only local, not including any other sustainability factors, and it was a national-based survey. I think it was from the Trends in U.S. Local and Regional Food Systems report by the USDA Economic Research Service, and that came out in 2015. So again, these are all listed in our report, but we can share it as well in the chat box to everyone.
Perfect. Another question is, are you aware of any similar GFPP efforts or studies that have been conducted in Hawaii? Colleen, do you want to jump on in?
Yeah, I am not aware of anything in particular happening in Hawaii around GFPP specifically. I know that we've shared some information with somebody a while back that was in Hawaii, but we never gained any like particular traction around it. So that's the best of my knowledge around that.
Great. Another question we have is, you addressed the big three food service companies, but with 40% of other food service programs being self-operated, there are other food system related barriers that exist, and are we working to address those barriers? So in the report, as I said, we really didn't do a substantial review of those other barriers that are faced. Colleen Synk had some information about that, but you know, I think the Center for Good Food Purchasing's policy begins to look at some of those barriers potentially. They just weren't the focus of the instituting change report. So let's see. Another one is, how is the Good Food Purchasing Program paid for in the regions, and have you seen interest in Canada?
Sorry, I just unmute myself. So the Good Food Purchasing Program, so far in most of the places that we've worked, has been subsidized through foundation grants, but we are trying to develop a sustainable model that incorporates some component of funding through the local institutions or foundations in the cities that we're working. So we're exploring some concepts around joint grant proposals to local foundations in cities that we're working as one model to fund the analysis and technical support work that the center can provide to local institutions, and also exploring potentially in the future concepts like working with private institutions, which are a little bit outside of our specific mission to work with public institutions, but may help subsidize some of those costs for working with public institutions that don't have funding set aside in their budgets to specifically support the verification and technical support of the center.
Great. So another question is, are there any GFPP activities happening on Indian reservations?
Not to date. Jose, do you have any other?
No, I was going to say that that's a very particular interest of ours at Food Chain Workers Alliance. So if you know anyone, please connect them to us.
Great. So someone asked if there will be a recording of this webinar available to share, and there will be. We will send that around. Let's see. So one other question is that for people interested in organizing efforts to adopt the good food purchasing standards in other cities, what are some of the hurdles that people may face, and what are some of the essential first steps in organizing a coalition? Maybe who to approach when you're considering building a coalition in support of adoption of the good food purchasing standard.
Why don't I take the coalition part of the question, and then Colleen, maybe you want to talk about the hurdles a little bit. So you know, obviously you want to make sure that the folks engaged represent real people, and then that they are representing the value categories, right? So you want to have someone that's keen on nutrition, folks around labor, folks that are environmental organizations, folks around animal welfare. And it's pretty critical to have all of the value categories represented early on, because it is, you know, at least my experience with this is that in order for the coalition to be fully invested in moving something like this, there really has to be a reflection of their own constituencies in it, right? And so the earlier you can, you know, connect with all of those sectors, the better. I think it isn't always easy. I know it's easy for me to say that those are the sectors that should be involved, but I think, you know, we've developed a set of sort of best practices and a little bit of the sort of power mapping tools that we've used in some of the other cities, and we're happy to share that with folks who are interested in doing it in their cities.
In terms of barriers or challenges with getting GFPP sort of up and running in a location, I think that you know, just identifying the funding to support the work, I think, is one question that is raised commonly. But on a more like a bigger picture scale, building buy-in from everyone that is touching the GFPP work in some way, all the stakeholders in a location, I think is a process that takes time. And you know, we found that the most successful places that we're working are places where there is the really strong coalition, like Jose described, that can advocate for the importance of all 5 of the value categories and how they all work together around a bigger picture definition of health and community wellness. And also having an elected official who can champion a policy, who really understands the value of public participation in the procurement process and is willing to you know, advocate for more feedback in things like contracts and that the contract should include the GFPP values has been really valuable. And then finally, having a high-level department administrator who also understands the values and wants to really take ownership and make changes and work with us on getting the data that's needed to verify the commitment and is interested in setting goals and making improvement over time. That's, you know, the departmental administrators are in the end who is most impacted by the work in their day-to-day work. And so just having all 3 of those components has been what's made us the most successful so far. And that takes time to build, but it's been a really valuable process as well.
That makes sense. Someone asked if you've had, or if anyone has had success with funding from USDA for these efforts. I'm wondering if you can just delve a little bit deeper into funding and you know, initial steps or best practices that you found in other cities with people locating funding to support the adoption of the standards.
As far as I know, none of the work, the local work or the national work has been funded by USDA grants to this point, although I certainly think that there's some good opportunities there, particularly in thinking about a really strategic city approach where multiple institutions are participating and thinking innovatively about how to incorporate new suppliers in their supply chain together and aggregating some of the type of product from a number of small and mid-sized farmers in the region. So I certainly think there's, I could see potential for some really innovative and compelling concepts for USDA grants, but to this point, it's all been private foundation funding and a little bit of local city funding that supported the work that the center has at least done.
Okay. To switch gears a little bit, I guess this is a question for Colleen Synk. How is the Chesapeake Foodshed Network hoping the data analysis can support farm-to-school advocacy efforts?
So one of the main ways that we see it hoping or helping advocacy efforts is really with identifying those gaps. So focusing where we can be applying policy and advocating for policy in different sectors. As well as things that I didn't mention, we did some informational interviews as well, and so we're hoping to do some small case studies and stories to increase engagement and outreach, and so that we'll have a larger voice collectively across the region with more stakeholders as part of the Chesapeake Foodshed Network to help propel different policies throughout the region.
Great. And we had one other question. Are there any examples of food service management companies taking the initiative to begin sourcing locally, or do most institutions make local preferences and leave it up to the supplier to do the research and procurement after being pressured? And I will say that I have seen examples of food service management companies taking this initiative, in particular Bon Appetit Management Company. But I think there are several management companies now that are realizing the benefits of regionally sourcing, and they're certainly also feeling the pressure from consumers. So I think a lot of times we are seeing the initiative made from the food service management company.
And a couple of the people I interviewed this is Colleen Synk, by the way, interviewed as well, are definitely taking an initiative, and some of them actually in their distributions of their different product, trying to make the local product the default in which they're offering to their clients. So they're definitely seeing it as a value added and something that they're trying to give to their clients from the get-go.
Great.
Can I add to that? This is Colleen McKinney. I would say that I would echo other Colleen's comments about how food service management companies are seeing this as an opportunity and also responding in some ways to consumer demand and from institutions and from just general public awareness of these issues. But I definitely agree that is happening, and that certainly some of the food service management companies that we have had relationships with through this work have identified this as like something that they're including in their sales pitch and PR opportunities. But I also think that we've, through the verification process that we have been able to undertake, we've been able to see places in which, the commitment is really genuine, and also places where there's more work to be done to actually meet the level that a food service management company would like to be at in terms of, just identifying when there are times when there's not enough information about a product to actually know whether or not it's local, but it's identified as local in spreadsheets or things like that. So I just think that continuing to increase the transparency of the information that we're able to get from food service companies will continue to help guide toward better transparency and rigorous level of commitment on some of these issues.
Great. So I'm seeing no other questions coming in. So unless anybody wants to type one last question, I think that concludes our webinar. And as I said, we'll be having a recording and the slides, including all of the resources that were presented. We'll have that all available after the webinar ends. So thank you so much to all the presenters and for everyone who took time out of their day to participate. And have a great day.
Thank you, everybody. Bye-bye.